Hi, I'm Rose Hayden at Hunt Regional Healthcare. Today I'm visiting with Sally Rhodes, a registered dietitian at Hunt Regional Medical Center, and we're talking about diabetes. Sally, thank you for coming today.
Thank you for having me.
Absolutely. So diabetes has been called a growing epidemic. What is diabetes?
Diabetes is basically a problem with your pancreas. Either your pancreas quits making insulin, or you don't make enough insulin, or the insulin you do make, your body's just not using properly.
Okay, and I've heard type 1 and type 2. What does that mean?
So they're totally different. Type 1 is an autoimmune disease, basically, and the body quits making insulin over time. So that person's going to require insulin. There's really nothing you can do to prevent type 1. Type 2 is what we see in the majority of all Americans. Type 2 is when either the pancreas is not making enough insulin or the insulin it does make doesn't work properly.
What are the signs and symptoms of this disease?
Sometimes there's no symptoms at all. A lot of times with type 2, people don't know they have it till they go to the doctor and get screened. If they do have symptoms, usually the blood sugar's running very high, so it could be excessive thirst, frequent urination, sometimes unexplained weight loss without trying. Oh goodness. That's usually the main ones. Sometimes they'll feel tired, but they'll just chalk that up to, I'm not getting enough sleep, but sometimes lack of energy, and then sometimes hunger. When the blood sugar's high, believe it or not, you'll feel hungry.
Okay. And what are the effects of diabetes long-term on medical issues?
There's a lot, unfortunately. You're going to see heart disease, so strokes, heart attacks, kidney disease, sometimes kidney failure, nerve damage, so neuropathy, and that can be from the stomach, which can cause GI issues, and then it can also be the extremities, so feet. They'll lose their feeling in their feet, then they step on something, don't feel it, and they can have an infection, sores that won't heal well.
Okay. Now, what is pre-diabetes?
Okay, so pre-diabetes is a little bit newer term, and it is when you're in that stage before type 2. So your blood sugar is not quite high enough to be abnormal, out of the normal range that is, but it's higher than the normal range, but not high enough to be type 2 diabetes. So it can be like a red flag for someone. They can go to the doctor and get screened for that, have their A1C checked. That could allow them to know they're in that range, and they could do things to reverse it.
Oh, okay. So what can someone do to prevent diabetes?
Good question. So you cannot prevent type 1 as of now. They're still doing research on that, but type 2 is preventable, generally through physical activity. So nobody wants to hear that, but exercise. So 30 minutes, 5 days a week of brisk walking can reduce blood sugar, improve cardiovascular health. Of course, a healthy diet, so eating better, which sometimes we don't want to hear, but improving your diet can help. Losing weight, so even a weight loss of 5 to 10% of your body weight. So it does not have to be a huge amount of weight loss. That can reduce your risk of type 2 diabetes.
Okay. And what are the risk factors for developing diabetes?
Good question. So there's a lot. The risk factors start with ones you can't change. Things you can't change would be your age. As we get older, you're going to have a higher risk. Your weight is a changeable one, So the ones you can't change, your age, your ethnicity. Certain ethnicities have higher rates of diabetes. Some other things are going to be family history. So it's important in knowing your family history to know if you're at a higher risk for diabetes, because it's definitely a disease that runs in families. So many of the people we meet have moms, sisters, uncles, aunts, grandparents, runs really, really heavy in families.
Sure.
Things you can change. Weight. So risk factors, being overweight is a risk factor, having high cholesterol is a risk factor, being physically inactive, so kind of the opposite of preventing it. So a risk factor would be physical inactivity.
Okay. Now you are part of the diabetes education team at Hunt Regional Medical Center. What does that team do?
So we meet with individuals with a doctor generally prescribing the education, and we do one-on-one visits. And then we also do telehealth. So if someone does not want to come into the hospital or is at risk, for COVID and doesn't want to get out, we can do telehealth visits as well, which has been great. And we provide counseling not just for diabetes, but we talk about nutrition, weight loss, exercise, medications, checking your blood sugar. We spend probably the majority talking about nutrition.
Okay. And what results have you seen?
So typically, if someone follows our guideline and program well, you're going to see weight loss. They'll get their blood sugar down. They're most excited usually about that, to see those numbers come down. Typically their A1C comes down. A lot of times cholesterol. It's not just one thing that goes up. Usually everything goes up, meaning cholesterol, lipids, blood pressure, blood sugar, and when you make changes, they all come down together.
Okay, and you mentioned A1C. What's the difference between an A1C and just a regular blood glucose test?
So the blood glucose test, when you prick your finger, is just your blood sugar at that given moment. So blood sugars are going to be different all day long. It's just ever changing. The A1C is kind of like a batting average. That's how we describe it. So it's all your blood sugars, the average of your blood sugars in about 3 months' time. It measures your red blood cells. The lab does that, and they'll measure how much sugar is attached to those red blood cells. So it gives them an estimate of what your blood sugar has been like for about 90 days.
Okay, very good. Any last advice for our viewers?
My biggest advice would just be to move more. So any way you can have more physical activity in your day, taking the stairs, walking, treadmill, elliptical, Zumba, any type of exercise you like, that can definitely prevent type 2. Listen to your body. If you're feeling off, you have a lot of odd symptoms, definitely go to your doctor. So many people we meet have waited and waited and waited and said, I've felt like this for years. And then they find out, and their blood sugar is very high. So the earlier the better. And then try to eat more vegetables and fruits every day.
All right, always good advice. Yes. Now, thank you so much. We are wrapping up. We heard some really good information about diabetes. Please go ahead and get that checked out. We want to take good care of your health. And Sally, thank you so much for your time today.
Thank you, Rose.
This video has been brought to you by GEUS 34. GEUS is your community-owned provider for electric, internet, cable TV, and true local programming.